word says that for anyone who lacks wisdom, he should ask God, who gives generously. We ask today that you grant discernment for those making decisions, that they would act in fairness, impartial justice, and for the best interest of all student athletes. May established precedents guide this court toward truth as evidence is objectively evaluated. I want to thank you for Trinidad's inspirational character that we've seen exhibited in the locker room, to his unwavering faith that we've observed praying with his mom before games. When adversity struck, he stood up. When others walked away, Trinidad stepped up. And we ask that you would continue to mold him as an example for young people to look up to as a faithful man of God who leads with dignity, honor, and integrity. But most of all, I just pray, God, regardless of the outcome, that we would pray that Trinidad would continue to point people to Christ as he walks into his bright future. We know that you are the God who's extended to us eternal salvation by grace alone, through faith alone, in Christ alone, not because we earn it, but because you are a God who is good and graceful. You extended King Hezekiah's life 15 years, so today we ask for one more extension. In Jesus' name, amen.
Amen.
Face the flag, salute back. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Please silence all cell phones and electronic devices. No recording or streaming or taking photos without prior permission from this court. Thank you. All right, we recognize Mike Roberts, he's the transfer clerk of Lafayette County. This is a Lafayette County case, although we're trying it in Pittsburgh. I am the senior judge of 5 counties, Lafayette, Marshall, Benton, Chipper, Calhoun. So this court can hear cases from any one of those counties and any one of the counties. And that's one of the reasons, because my doctor is free in Calhoun. That's why this case is being heard in Calhoun. If you wonder why in the world we came to Pittsburgh. This is the case 2026 CV 017 Lafayette County Chancery Court. Trinidad Chambliss versus National Collegiate Athletic Association. Attorneys, Mr. Liston and others are representing Trinidad. Mr. Minor and his group is representing the NCAA. At this time, and we thank you, Mr. Logan, for your introductory prayer. It won't be preemptive of how I rule today. It was a very good prayer. So if you would each of you lawyers stand and introduce yourself so that the court reporter can get down the names of each of the attorneys on each side, starting with the petition.
Yes, Your Honor. My name is William Liston. Firm is Liston and Dees. I represent this gentleman to my right, Trinidad Chambliss.
Trey Byers from Oxford. Daniel Coker, also representing Trinidad.
Your Honor, Lawrence Dees, also with Liston and Dees for Trinidad.
Your Honor, Tom Mars from Arkansas, also representing Trinidad.
Minor?
Yes, Your Honor. I'm Doug Minor. I'm here with, from the Holland and Knight firm on behalf of the NCAA.
Taylor Askew from Tennessee on behalf of the NCAA.
David Zeitlin from Tennessee on behalf of the NCAA.
For the record, Mr. Mars, Mr. Agnew, Mr. Zeitlin have both been given pro hoc visa to be allowed to stand in and represent their respective clients by all of this court. All right, we're ready to proceed.
Yes, Your Honor.
Everybody's going to testify in this case please stand, raise your right hand, and be sworn. You plan to testify or may testify, stand and raise your right hand and be sworn.
Do you solemnly swear or affirm the testimony you're about to give in this cause is the truth, the whole truth, nothing but the truth, so help you God? Thanks.
Gentlemen, is there any need for sequester the witnesses?
No, Your Honor.
All right, so all of the witnesses will be allowed to testify and remain in court. Do we have any first witness?
Yes, Your Honor, we call Dr. Ford Dye.
All right, Dr. Dye.
Your Honor, may I proceed?
You may.
Dr. Dye, where do you live and practice medicine?
Oxford, Mississippi.
Are you medically licensed in the state of Mississippi?
Yes, I am.
When did you obtain your medical license?
1995 or 96,
Where did you obtain your undergraduate degree?
University of North Carolina.
Were you in any honorary societies at the University of North Carolina?
I was.
What is it?
Phi Beta Kappa.
Where did you attend medical school?
University of Mississippi Medical Center in Jackson.
Did you do an internship?
I did.
And where did you do that?
I did an internship in general surgery at the University Medical Center in Jackson.
What about a residency? Did you do that?
I did 4 years of the ENT residency at the same institution.
Okay, in what field?
Otolaryngology, head and neck surgery. They're known as ENT.
How many years? You said 4 years you were a resident?
Yeah, I had 4 years of med school, 1 year general surgery internship, and 4 years of residency.
I think you just answered this. I was going to ask you what an otolaryngologist is.
Yes, it's ear, nose, and throat physician.
Thank you. Are you a board certified otolaryngologist?
Yes, I am.
Can you explain to the court what was required for you to obtain your board certification?
First of all, you have to successfully complete a accredited residency program, which I did. And then it's a two-step process to get certified. There's a written exam that you have to take and complete and pass. And then after you pass the written exam, I had to go, I forgot where it was, I think Cincinnati. There's a 2-day oral board exam where different ENT experts around the country ask you different oral board questions. You have to pass that. Once you pass that 2-part process, you become certified.
And you achieved all that.
I did.
Do you practice in any cities in Mississippi other than Oxford, Mississippi?
I have a clinic in Grenada.
How long have you practiced otolaryngology in North Mississippi?
26 years.
Younger, at this time, I would offer Dr. Dye to the respondents for any board hour questions they may have. It's my intent, of course, to tender him to the court as an expert witness in the field of otolaryngology.
Mr. Hunter, you all wish to ask him any questions, or you accept him as an ENT doctor licensed in Mississippi?
Yes, Your Honor, we will accept it in that.
Dr. Dye, I'm going to be asking you some questions today. Some of them are going to be factual. Some of them are going to call for you to express an opinion. All right? I want to strike an agreement with you right now. If I ask you for an opinion question, will you agree to express that opinion based upon a reasonable medical probability? Thank you.
By the way, can everybody hear me out there, all the way in the back, when I'm speaking? You can't hear me? All right. I'll try to speak up. Is this on? Do what? Test, test. All right. Can you hear that? Yes. Okay.
Then, Your Honor, kindly, I'm going to ask the witness to speak up. All right. Dr. Dye, did you, at my request, review some documents?
I did.
Can you tell us what documents you reviewed?
Medical history of Trinidad Chambliss.
Did you review any correspondence written by a doctor in Michigan?
I did.
Okay. And I'm referring to Dr. Anthony Howard.
I reviewed that.
Okay. You have seen that letter, right?
Yes, I have.
Who do you understand Dr. Howard to be with regard to Trinidad?
He was a ENT physician who was treating him in his time in Michigan.
Okay, thank you. When you reviewed Dr. Howard's letter, did you give it any weight in forming your opinions?
Absolutely, because he was a board certified physician taking care of him and knew his case better than anybody.
You read both Dr. Howard's letter and Trinidad's medical records, right?
Correct.
About 90 pages of medical records.
It was a good bit.
In your opinion, was there any conflict between those two documents?
Not that I could tell, no.
In the medical records, did you see an office visit that Trinidad had with Dr. Howard in December of 2022?
I did.
You've seen, do you even know the number of patients you've seen in your medical practice?
I have no idea. There's a lot.
Okay. Has a patient ever come into an office visit with you and said that they're doing well?
Yes.
Okay. And when a patient says that, does that indicate to you that patient's cured?
No, it's not. Just a couple examples. When a patient comes in and says they're doing well, I give one example or a couple of them. When somebody comes to see me for recurrent sinus infections, we're trying to figure out whether they have a chronic infection that might need surgery or if they have an allergy problem that's caused recurrent infections. And what we do, we'll treat them for 3 weeks and get a CAT scan, and the patient will come out with the CAT scan and we'll look at it. And I can tell you on a number of occasions, I've had the patient look me in the eye and say, I feel so much better. And then we go back and look at the CAT scan, and the CAT scan's completely blocked, and they're better right there, but they're not well. They're not fine, and they have continued problems. And another, more pertinent to Trinidad's case, sleep apnea. Now, over 26 years, I've done a lot of surgery on sleep apnea patients. And most people that have sleep apnea don't realize how bad they feel until they get the problem corrected, either the surgery or CPAP or some other procedure. Usually they realize how bad they were feeling and how regularly they were tired after they get corrected. That's the case with Trinidad as well.
Okay. So could it be that a patient with that condition, sleep apnea, knows that they're tired or fatigued, but they don't understand why?
That's their baseline status, and that's what they think is normal.
Okay. In the context of Trinidad's medical history, and by that I don't just mean on December 2022, I mean the whole history.
Okay.
Okay. What significance do you give to a statement in December 2022 that Trinidad did well?
He was doing better at that time. And I actually talked to Trinidad about that. He was doing better at that time. And really, at that visit in December, the option was to continue medical management, which had helped some, or to proceed with tonsillectomy and amidectomy, which is not a benign procedure. And at that point, he was feeling better, so he decided to keep trying the medicine, see if he could continue to improve. But ultimately, he did not, which led to his tonsillectomy 2 years later.
Okay, thank you. I want to ask you about what Dr. Howard recorded in medical records that you reviewed. Okay. And on August 1, 2022, Trinidad went in to see Dr. Howard for the first time. You familiar with that?
I am.
Okay. In that record of August 1, 2022, would you agree there's no reference to the magic words incapacity to play college football?
There's not.
Okay. Do you find that odd or unusual in any way?
Not at all, because Dr. Howard's office was an hour away from Trinidad's school, and the referring provider was a primary care doctor, not the, there's no point for that doctor to make any assertion to that effect, unless the football coach had sent him to him for a clearance, which is not the case.
Okay. In your medical records that you maintain and create, do you address esoteric questions like incapacity to participate in a particular activity unless the patient or someone else requests you to do that?
I do not.
Have you seen, other than today, have you seen Trinidad Chambliss?
Yes, I talked to him over this week.
Okay. And what was the purpose of you seeing him?
Just to get a medical history and kind of get his viewpoint of what all happened.
Okay. Did you perform a physical examination of him?
I did not,
Why not?
because his symptoms have resolved. He basically was cured with his tonsillectomy and animodectomy in 2024.
Can you tell us what history, medical history, Trinidad gave you when you saw him earlier this week?
Sure, I got a general medical history from him, and then I asked him about obviously what we're talking about here. Basically, in 2020, he had a case of mono that started his tonsillitis episodes, the worsening of those. And that's a pretty common thing. Tonsillitis is a bacterial infection. Mono is a viral thing. I've living in Oxford, Mississippi for 26 years, taking care of a lot of college students. And when they have a mononucleosis infection on top of a bacterial tonsillitis, it makes it significantly worse. And also leads to increased swelling. That's what started all his problems. And then he had COVID, I think it was New Year's Eve of 2020, which was diagnosed at that time. 3 months later, he goes to the emergency room with chest pain, palpitations, and shortness of breath. Had a workup. Subsequently saw a cardiologist. His heart was okay. That was COVID. That was 3 months after his infection. He was in the ER with those complaints. From that point forward, he kept having trouble breathing, trouble sleeping, sleep apnea symptoms, daytime somnolence, fatigue, and it went on. And he finally saw Dr. Howard in August of 2022. And Dr. Howard, I think at that point, I'm just reading between the lines, but wanted to get his tonsils and adenoids out. But that was in August before school started. And I take care of athletes in Oxford as well. You would never want to take tonsils and adenoids out at the beginning of any season unless you're completely torpedo the season. Plus, at the beginning of school, when I take tonsils and adenoids out, you try to do it either Christmas break or summer break or maybe spring break, because you're going to miss 2 or 3 weeks of school. And unless you're just an incredible student, missing the first 2 or 3 weeks of school is going to really, once again, torpedo your academic progress, separate from football. And I have some college students, just regular students, that we have a hard time getting through the semester when the tonsils and adenoids are having similar symptoms to this. That went on for a while. Dr. Howard gave him some Flonase and Singulair, which seemed to help his symptoms somewhat, and that's what led to that visit in December where he was doing better. And after talking to Trinidad, he was not well, but he was better. And at that point in December, the option was, are we going to get your tonsils and adenoids out now, or are we going to try this medicine longer? And as a physician, I try to avoid tonsils and adenoids if I can.
You mean
The surgery,
avoid what?
because of the risk.
Avoid the surgery on it?
Avoid the surgery if you can. Whenever you have a chance to continue medical management and you can avoid the surgery, that's a better thing to do. I saw 4 patients this week in my clinic that were sent to me for tonsils adenoid removal, and I said they're not indicated for it. We're not going to do it. You always weigh the risk versus benefits, and I think he was weighing his risk versus benefits at that time, as was Dr. Howard, in my opinion. And they decided at that point to continue to try to move forward. He subsequently kept going, and finally, after 2024, he just kept getting sick, wasn't feeling well. Finally had his tonsils adenoids out, which was a very difficult recovery, which I think he'll attest to. But since that time, he's been fine.
Let's talk about tonsils and adenoids.
Okay.
First of all, where are the tonsils anatomically located?
Your palatine tonsils are lymphoid tissue in your mouth, you can see. The adenoid tonsils are some lymphoid tissue. If you start your nose and go straight back, or the back of your nose meets the top of your throat, that's where they're located, the nasopharynx.
So one's located through inside the mouth, right?
Correct. That's palatine tonsils are what you see in your mouth. The adenoids are behind the nose and nasopharynx.
What happens when those tissues swell?
Causes trouble breathing and swallowing at times.
Can it have adverse effects on the patient both in the daytime and at nighttime?
Sleep apnea is a very problematic illness. I mean, it's almost like anybody that's sitting in this courtroom will attest, if you don't sleep well at night, you're probably not as sharp the next day. You do that every night over and over again. There was a study done on first graders that had adenotonsillar hypertrophy and symptoms of apnea. They had their tonsils and adenoids out between first and second grade. and their performance in school improved dramatically in second grade after having that procedure. If you have sleep apnea, it causes daytime somnolence, fatigue, loss of energy, difficulty focusing, and it's a chronic problem. And it also can lead to some arrhythmias, heart palpitations, and heart issues when you get hypertension when you get older.
If an individual who's a collegiate athlete is trying to play a sport or even train and condition and develop in order to be able to play a sport, what kind of effect can the conditions you just described have on that person?
He's not going to be 100%. He's not going to be able to reach the full potential of training and endurance and all that. He's not going to be at his best.
In other words, he's not gonna be able to get in shape where he's
He would
ready
be-
to go full steam.
Not
ahead.
at that level, correct. He's not going to be able to do the training necessary to play at that level.
Can a tonsillar infection go away, but the patient be left with an obstruction to his airway that would cause him to have sleep apnea every night?
Yeah, generally speaking, with bacterial tonsillitis, when the acute infection gets better, the swelling goes down, but with mono, it's different. Mono is just exudated, or lymphocytic infiltrate that hits the tonsils, and you can have persistent swelling for a while with mono, and that varies from patient to patient, but it can last months, even longer than that.
Okay. Would a patient that has sleep apnea fully appreciate the degree to which he has it?
Not until they get the problem corrected and they realize how bad it was.
Okay. If an observer was watching that patient sleep during a period of sleep apnea, how could the observer detect if he's suffering?
Stop breathing. And also stop breathing and also struggle to breathe and have some retractions where you're trying to pull air.
Even though Trinidad told his doctor in December 2022 he was doing better, did his adenotonsillar hypertrophy go away?
Didn't go away.
And when I use that term, I think I know what it means. You really know what it means. What is adenotonsillar hypertrophy?
It means when your tonsils are enlarged and your adenoids are enlarged, and it prevents your normal exchange of air and breathing.
So I'll understand it. Dr. Howard said that his tonsils were like +3,
Correct.
and they were pretty much the same thing when he came back in December.
They were.
Is that correct?
I think he said 2 to 3 at that time, but right, at the same, they were not, they were still enlarged, correct.
That's a
When
good
he said
question.
he was better, he still had.
He was better, he wasn't well.
So I've got a question based on what the judge just asked. In August of 2022, Dr. Howard graded Trinidad's tonsils at 3+.
Correct.
And then in December 2002, he graded them at 2 to 3+.
Correct.
Okay. How much of the airway through the mouth can 3+ tonsils obstruct?
Usually 60, 75%.
If a patient has chronic tonsillitis and chronic adenoiditis, is the patient going to sense pain?
When they have acute flare-ups. When you have a tonsillitis acute episode, it's infected. And usually antibiotics and steroids get that better. But when you have acute flare-up, you have the pain. Once it gets better, in between you don't feel the pain.
Okay. You reviewed Trinidad's records, right?
I did.
Did he have flare-ups?
I don't have it in the records, but after my conversation with him, Dr. Howard's office was an hour away from Trinidad School. As an ENT doctor, I'm a specialist. I don't do as much primary care. Like these patients I saw earlier this week, I saw one patient that had not quite enough infections to merit getting them out. I'm going to see him back in 4 months. If they have an acute flare-up between visits, it's not, Dr. Howard wouldn't have that record. It's going to be either primary care or urgent care and according to Trinidad, he had a few episodes, which the trainer's records also agree. He was in the training office and got some medicine at the school as well. The trainer's letter that said on there that I don't have any records from the trainer, but the trainer's letter said he was constantly sick and in the training room repeatedly needing medication for these symptoms.
Right. What type of medication, like over-the-counter med?
I I don't know for sure, it wasn't specified.
Okay. Well, let me ask you about a particular record. Have you seen a record of an office visit Trinidad had with his ENT clinic back at home that's dated in November 2024?
I have.
Do you recall what history Trinidad gave in that record about flare-ups?
He's had continued flares and continued to be sick and still didn't feel well, and that's what led to his tonsillectomy.
Do you remember whether or not that history, as recorded in that record, says flare-ups over the last year?
I don't remember the exact details, but I mean, he been having recurrent flare-ups.
Okay. Dr. Dodd, some people might be inclined to dismiss tonsillitis and adenoiditis as just like childhood diseases. Would that be smart of them to do that?
It's not, it affects all ages.
Okay. Have you seen instances where those diseases affect adults worse than they affect children?
You know, children are a little more resilient, generally speaking. I mean, and like a child that has sleep apnea or chronic tonsillitis, I mentioned the example of some school-age children, but you know, when you get to be older, you have a little extra body weight and not quite as in shape as a child, you know, and it's just hard, you know, it can be more problematic in adults, but even children and adults, it's very variable how these affect different people. Sometimes there are mild cases that aren't that bad. Other people have more severe cases. Like any I've used this example, influenza. People die from the flu every year. Do most people die from the flu? No. People get the flu all the time and they're fine, but there are some people that do die. And a lot of that has to do with their immune system, comorbidities. Once again, I think when you're not getting good sleep, your immune system can be adversely impaired.
Okay. Do you believe, based on reasonable medical probability, that Trinidad had any kind of immunity issues or problems going on?
Well, I think the mono and the COVID didn't help matters, and I think with his sleep apnea, what he's describing, chronically tired, I don't think his immune system was where it needed to be.
Let's talk about the surgery for tonsils and adenoids. Am I pronouncing that word correctly?
You are.
All right. What do you counsel your patients about that surgery with respect to pain and recovery?
I tell my patients, you know, I do a lot of tonsils and adenoids, but the first thing I do, I make sure that the criteria, you know, the American Academy of Head and Neck Surgery has criteria for tonsillectomy and adenoidectomy. It's a certain number of infections each year. I'm on board with that, or sleep apnea. First thing I do is make sure that it's indicated. I tell a lot of parents we're not going to do this, and adults. And I tell my adults, I saw one yesterday in my graduate clinic. I told her, I said, look, you don't want your tonsils out unless we have to, because it's the worst thing I do. I mean, I don't want to hurt my business, but
What do you mean the worst thing you do?
painful. I mean, it takes 2 weeks to recover from a tonsillectomy at least. When we're talking about missing school, missing work, there's a risk of bleeding. The most feared risk is bleeding, which can occur, which fortunately does not happen a lot, but it does happen.
Yeah.
You have to be in a deep sleep to have that surgery, don't you?
Oh, you're sound asleep. Sound asleep. But yeah, it's a very tough recovery. I mean, I tell my, you know, there's a risk of bleeding. Sometimes we have to go back to surgery to stop bleeding. The pain lasts for 2 weeks. And I use this example all the time. I tell my patients, you know, you have knee surgery, that hurts, but you can prop your knee up on a pillow, take a pain pill, eat your favorite meal, and watch TV and forget about it. You can't forget about your tonsils. Every time you swallow, talk, clear your throat, it just hurts. And it's a tough. Some people have to have IV fluids to get dehydrated, and it's more common in adults. And tonsils is known to be harder, and the older you get, the harder it is.
Have you known patients in your practice who will deal with a problem like tonsillitis and adenoiditis for years before they finally decide to have a surgery?
Some of them do.
And why do they do that?
Well, they're just trying to avoid the surgery. I mean, the surgery, most people who know someone that had a tonsillectomy or adenoidectomy, tonsillectomy is the main problem with the pain. Want to try to avoid it. I mean, that's a good thing if at all possible.
Okay. Is it a risk-free surgery?
Not at all. I mean,
What are some of the risks of the tonsillectomy and adenoidectomy?
well, I mean, the main risk is bleeding. That's the most severe complication. And I mean, bleeding can rarely lead to death and airway loss. I mean, that's Fortunately, we don't have death in tonsillectomy very often, but it occurs. Then
Are you personally aware of instances where patients have died
I am.
after having
I am.
those surgeries?
I am.
So let me ask you a hypothetical question. If in August of 2022, when Trinidad first saw Dr. Howard, which was right before the 2022 Fair State football season, if Trinidad had undergone a tonsillectomy and adenoidectomy at that time, what effect was it going to have on him with respect to going to school and football?
Like I mentioned earlier, I would not do tonsillectomy and anemoidectomy on a second grader or high schooler or freshman in college that wasn't playing sports in August. I don't do them, unless they have a severe, abscess or some kind of rare abnormality. But if you're going to miss 2 or 3 weeks, and you're not going to be able to sit in class. You're going to be missing 2 or 3 weeks of school, get behind, and you throw the football on top of it. I would never do that at the beginning of a football player's season in August.
Okay. You've read Dr. Howard's letter, as you said.
Yes,
It was written in October 2025.
correct.
He's the same doctor that treated Trinidad for this problem, right?
Right.
Okay. There's some statements in there, and I don't think I need to quote them because the court has the letters and evidence. But I want to make reference to some of these statements. Dr. Howard commented in his letter about how Trinidad's medical conditions back in 2022 would impair his ability to train, condition, practice, prepare for game. You remember that?
Absolutely.
Okay. As a board certified otolaryngologist, do you agree with what he said?
I do.
Is there anything in that statement that you find inconsistent with Trinidad's medical records from that time?
No.
Dr. Howard also remarked about recurrent infections and disrupted sleep as a result of the conditions which Trinidad had. As an expert, do you have any reason to disagree with that statement?
Not at all.
And I think that finally, Dr. Howard, in the conclusion of his letter, stated, and I'm quoting here, Trinidad's chronic tonsillitis represents a medically valid basis for hardship consideration as his condition rendered him incapacitated and unable to participate in the 2022 season, end quote. Did you see that in the letter?
I did.
As a board certified otolaryngologist, do you disagree with that statement?
I don't.
And is that statement consistent with the history that's actually in Trinidad's medical record?
It is. And I think the COVID and mono on top of that also play a role.
Okay. Let's talk about the COVID. That disease first hit the United States, I think, in January of 2020.
I think so.
Okay. So it was new to medicine, right?
It was a crazy time.
Okay. Has research since been done on the long-term effects of COVID?
It's evolved over time. We're starting to find out secondary long-term effects of COVID that, but back then it hadn't been around long enough to know what the long-term effects were, but yes.
Okay. Have you heard the terms long COVID?
I have.
Okay. They're actually, we could go on the internet and find
CDC has
medical articles on long COVID, right? But were all those articles available in 2022?
Maybe in the infectious disease, but not routinely, no. You wouldn't find it on the CDC's website. I haven't looked, but probably it was an evolving time, so probably not.
So if Trinidad had long COVID in the fall of 2022, there wasn't a lot of medical information publicly available about that, was there?
Probably not. Or it was evolving if it was.
All right, let me ask you a few questions about Trinidad's performance as a quarterback at Fair State in the fall of 2024. You didn't know him at that time, obviously. Did you even know he existed?
I never heard of it.
Okay. Have you become aware that he has success playing quarterback at Fair State in the year 2024?
I have.
And that he performed at a pretty high level?
He did.
And did he share that history with you when you were talking with him?
He did.
Okay, thank you. Do you have an opinion why? Stop. Let me start here. Did Trinidad still have chronic tonsillitis, chronic adenoiditis, and adenotonsillar hypertrophy in the fall of 2024?
He did.
As a medical expert, how do you explain that a young man with these conditions was finally able to perform at a pretty high level on the football field?
Well, I think going back to the 2022 season, he saw it to Howard in August of 2022. I don't think he had the ability to prepare for that season or conditions for that season or training because of his situation. I think the Flonase and Singulair helped his situation, didn't cure it, made it better, as far as the obstruction, but it helped it. And also, I talked to his mom, Cheryl. I think being in a college football program of conditioning, nutrition, and they both Trinidad and his mother focused on him getting good. He was not able to be a regular college student. He was trying to get rest and sleep and be very focused on that. And I think over time, and maybe some of the effects of the long COVID and the mono were starting to wear off by that time as well. So versus 2022 versus 2024, he's been on medication for 2 years. He's getting better nutrition, trying to focus on getting the best sleep he can, which is it's not perfect because of his tonsils adenoids, but he's able to condition a little bit better because the medicine's helped. So I think all that together allowed him to improve the situation.
Is sleep apnea the same thing as obstructive sleep apnea?
Well, obstructive sleep apnea is what you have when the tonsil adenoids are large. There's other causes of apnea, some of it's central, which is a different thing, but he had obstructive sleep apnea because his obstruction is a problem.
Right. And I may have asked you this, apologize if I have. What sort of effects in the daytime will a patient with obstructive sleep apnea experience, and particularly a young man who's trying to play collegiate football?
Daytime, you're tired during the day. Daytime somnolence, you're fatigued. Your ability to focus is not as what it should be. Young children, a lot of times, young children are diagnosed with attention deficit disorder. And when you get their tonsils and adenoids out, you do a history, they have apnea, you get those out, they're miraculously cured. It's wrong diagnosis. They're diagnosed with that because they can't focus and their behavior is affected because they don't sleep every night.
I think I have just one more question for you before I give the NCAA an opportunity to question you. In your opinion, based upon reasonable medical probability, how do you explain a person like Trinidad who goes from being a Division II quarterback to, and yes, I'm going to say it, the best athletic conference in the United States of America, the SEC, and perform at the level that he did in fall of 2025 so well that he was a finalist in the Heisman vote? How do you medically make that make sense?
He never was 100% until after he recovered from his tonsils adenoids that was performed in December 2024. So basically last January, after he recovered from his tonsils adenoidectomy, he quit taking the Flonase and Singulair like he didn't need anymore. He's no longer snoring. He's not tired during the day. He's able to exercise and condition at 100% without limitations. And that to me explains, it's an incredible story, but it explains to me how you can go from that level to that level. This year is the first year he's been healthy, or last year, I should say.
Thank you. Your Honor, I will tender Dr. Dodd questions.
Cross-examination. Mr. Askey.
Yes, Your Honor. Morning, Dr. Dodd. My name is Taylor Askin. Thank you so much for being here today. Thank you. So when did you first meet Mr. Chambliss?
Yesterday,
First time you've seen him in person?
first time I met him was yesterday.
The only conversation you ever had with him was yesterday?
That's correct.
Is the basis for your opinion and testimony on what Mr. Chambliss was experiencing from 2022 to 2024 based exclusively on that conversation and what you reviewed his
It's
medical
just the
records?
records in that conversation, correct?
What does it mean to you to be incapacitated?
And that's a very, probably unable to completely perform your function of your duty, whatever that may be.
Can you explain that a little bit? Do you mean can't perform it at all,
No,
or just not performing at the highest level?
Probably to the highest level.
Do you know what incapacitated means for purposes of NCAA guidelines?
I have no idea.
Have you ever been asked about it before?
I have never.
You ever testified on behalf of a student athlete before in an NCAA case?
I have never.
And I've got copies of the medical records to the extent you need to look at them, but would you say you're pretty familiar with what's recorded in those records?
Fairly.
There is a notation in the August 1st, 2022 medical record when Mr. Chambliss first presented to Dr. Howard. Do you recall in that medical record a notation that says, we're not going to do surgery, essentially we're not going to do surgery because the football season has already started?
I do.
To you, did that mean that they weren't going to perform surgery then so that Mr. Chambliss could continue participating on the football team at that point?
Or to try to do so, yes.
You had testified earlier as well that you would not have recommended surgery on August 1st because Mr. Chambliss might miss some classes.
Well, school, you are correct.
So how long do you believe Mr. Chambliss might have been held out
2 or 3
classes?
weeks. 2 or 3 weeks.
2 to 3 weeks. Do you know when Ferris State's classes began in 2022?
I don't know after Howard's surgery schedule either, so I don't know either one.
So if he had, well, let me back up. If I represented to you that the first day of classes at Ferris State in 2022 was on August 29th, would you have any reason to refute that?
I would not.
And that's more than 4 weeks after August 1st.
That's reasonable.
And so if Mr. Chambliss had had that surgery anytime in the first 7 days after August 1st, he would be back in class before school started.
Probably.
Are you aware that Mr. Chambliss practiced during the 2022 season?
I am. We talked about that. He told me he was a rotational player on the scout team.
Are you aware that there were a number of other quarterbacks also on the Ferris State team at that time?
I don't. Apparently, so, but he said he rotated.
When Mr. Chambliss presented again to Dr. Howard in December of 2022, do you recall reviewing a medical record at that time?
I do.
And in that record, it says something along the lines of, he's doing great, he just won the national championship, we'll reevaluate him in a year, right?
Said he was doing well, and I actually asked Trinidad, his mother, about that visit, they talked about at that point our options were to get our tonsils and it was out, and when I asked him that, they were doing better, but not well, and I'm not going to. Some doctors, as far as the documentation there, I don't know that was discussed. They did discuss at that point, are we getting our tonsils and out, or we need medication? And he was doing better, and they felt like at that point, the risk of getting out was higher than continued observation. But he was not. I mean, I think that in my practice, I've got 2 partners. One of them documents everything. One of them is not as good as a documentarian. It doesn't mean that they're both great doctors. But reading between the lines there, if I had been in Dr. Howard's shoes, I would have tried to avoid the tonsillectomy. And obviously at that point, Dr. Howard had no idea his records would be under this microscope in the future. Nobody did. But I'm just saying that was the story I got from Trinidad's mother, that they had talked about getting the tonsil was out. He was doing better with the slow nature singular, but they wanted to give us some more time to see if things would continue to improve. And obviously they did not, because 2 years later he had his tonsils out.
You testified a moment ago that your definition of incapacity means not being able to perform at the highest level.
Or at an adequate level to do your job. I would say I'm not.
When did Mr. Chambliss become capacitated and no longer incapacitated in your opinion?
After he had his tonsils and was out. He didn't no longer had sleep apnea, and he was able to sleep better and have more energy at a higher level, focus, and endurance.
So it's your testimony that during the 2024 Division II college football season, when Mr. Chambliss was the starting quarterback for the national championship team, and a finalist for the D2 Heisman, he was incapacitated because he did not have his
I
confidence.
don't think he was at his full potential at all.
So just to square that circle, for purposes of your testimony on what the definition of incapacitated means for purposes of this case, Mr. Chambliss was incapacitated in 22, 23, and 24.
I think he was better in 24 than he was in 22. 22 is the season that I think is the season we're talking about. I think with I mentioned earlier in my testimony, with the medication he was on, the training, nutrition, and trying to get better sleep and focus on that, 2024 he was better. We're not talking about 24, we're talking about 22. I think 22, he didn't get the medication until August of that year, had no training, he was behind in his conditioning, and by 24 he was able to get he had also had 2 years of maturity. I'm not going to get into look, I'm a doctor. I don't have the thesaurus out of the dictionary about incapacitated definition, or I'm just saying that he was not, 2022, I don't think he could adequately perform the duties of a college football player that was needed to be able to compete.
And other than talking to Mr. Chambliss and his mother, have you talked to anybody at Ferris State about Mr. Chambliss' performance in 2022?
No, but I read Dr. Howard's letter. It was had no reason to doubt. I've also seen the senior athletic director for athletics, her note, and a trainer's note as well. All three that said that he had chronic illness that prevented him from being, I read all three of those notes. I mean, that's what I have to go by. I have no reason to doubt their notes.
You referred to a letter from Ferris State just now. I want to make sure we're talking about the same document. Is this the document from Sarah Higley?
There's another. There was a trainer too, maybe Brett. Maybe I can't remember his name exactly. I don't.
Brett Knight?
Yeah, Brett was his name. It said that he vouched that Trinidad was in the training room sick the whole fall of 2022.
Didn't he also say that they didn't have any contemporaneous notes of those visits, though?
Yeah, I don't know what Division II. I know at Ole Miss, if I see an athlete, we have a note. I send it back. I don't know what their protocol is.
Right. You just
I just went by his letter. That's all I've got.
And that letter was written after the fact, correct?
I don't know for sure. I can't. I think it was. I don't remember the date on that letter for sure.
Whatever the date is. What
Yeah, I don't. I just going by what they wrote and said.
But that letter from Ms. Higley, it discusses the 2022 season. And there's a section in it called Basis for Waiver Request. If you'd like to look at it, I'm happy to show you a copy of it, or if you remember, we can just talk about it. Would you like to see the document?
That'd be fine.
You're on me, question witness.
Two letters from Ms. Higley, which one are you referring to?
This one, you don't have a copy for you. It's not dated, so I don't know exactly which date.
Your Honor, I believe that's Exhibit 4 to the plaintiff's motion for preliminary.
To the plaintiff's petition?
Yes, Your Honor.
Yes. Excuse me, Your Honor, we have stipulated, right, that all of the exhibits that have been filed with the court may be admitted.
That's correct, Your Honor.
If you look at this first page,
Okay.
it says Basis for Waiver Request. You see that section?
I do.
What's the first sentence say in that section?
The decision to redshirt Trinidad in fall of 2022 was based on his developmental needs and our team's competitive structure.
Okay.
Have to slow down.
I'm sorry.
This lady's gonna take down everything you say, so you gotta.
I'm sorry.
And I'll read it to you just
You
so,
want you to
yeah.
read it, but yeah.
You would agree with me that the first sentence says the decision to redshirt Trinidad in fall 2022 was based on his developmental needs and our team's competitive circumstances at that time.
That's what it says.
Period.
Okay.
The second sentence is Trinidad also had a few medical problems that arose during the fall 2022 season that could have played a role in the decision to redshirt. What does the word could mean?
Yeah, I mean, it could have, but I think I think from when I read the records talking to him, I think it did play a role. And I'm a doctor and she's not. I'm just saying, I deal with this stuff all the time.
And
I deal with college students that have these issues every day.
Fair enough, but you were not there in 2022 to see
No, I
him
was not,
participate.
but I read the letter that the doctor that was there, what he said.
And based on your understanding of incapacity, Mr. Chambliss could still participate in football. He just couldn't do it at the highest level or to his maximum level.
unless he had flare-up with his tonsil, if he had an acute tonsillitis infection, he probably had to miss some days because of being sick. And once again, I wasn't there with him at that time, but if you have an acute tonsillitis episode, no, you can't practice football. You're usually going to miss, say you have 4 or 5 episodes of tonsillitis in the fall during the football season, you're going to miss 3 or 4 days when you have acute flare-up. If you don't, you're sick.
If that's the case, then would you have recommended surgery at some point between 2022 and December of 2024?
I would have talked about it, but that I would have given the option for that. But once again, I think from talking to Trinidad and some other, I think the risk of the surgery concerned them. It's obviously it would concern anybody, and I think also he was. I think it was a concern for him.
So he
And
just
I wasn't in there, and I couldn't look at him. But I would say this I would do all I could to avoid surgery if I could, just because of the risk. But if we weren't getting better at all or getting worse, I would have considered it. I think they had that discussion during that. I don't think Dr. Howard documented that in his note, but that was a discussion that was had in that December visit.
Have you seen anything in any of the documents that you've been provided that Trinidad was ever instructed not to practice or participate in football?
I have not.
Have you seen anything that said he was held out of any part of the Ferris State football?
I don't have any records from Ferris State, so I wouldn't have access to that.
So
Other than these letters is all that I've got. That you've seen.
correct. And there's nothing in these letters that said Mr. Chambliss ever missed anything related to football because of his tonsils.
No, but once again, a college football player that had tonsillitis and had sleep apnea and had problems like this would inherently miss some practice. I don't have a record of it, no, but I'm just with the clinical history and his background, he would have missed some practice.
How much practice do you think he would have missed?
Like I said, every flare-up he had, probably 3 or 4 days at least. And
How
then
long? 3 or 4 days.
probably miss. If you had acute tonsillitis, you don't feel very good. And in his situation, if he had acute tonsillitis, there'd be extra swelling, which probably would make his apnea symptoms worse during that period.
So if he had his tonsils out, how much practice do you think he would have missed?
He would have missed probably 3 or 4 weeks of that after surgery for sure.
You said.
But also, if you had your tonsils out, I'll say this too, whatever gains you've made, I've seen some other athletes at other schools, with similar situation. I would not take their tonsils out before at the start of the season, or it would be hard to recover and bounce back from that.
You said you had some experience with the University of Mississippi Medical Center.
Yes.
What was that experience?
I went to med school there for 4 years and did a year of general surgery internship and then 4 years of residency.
It's a good school, correct?
Yes.
If they post things on their website about treatment, prognosis, and things like that, would you agree that it's generally pretty accurate?
Depends on what it was. I would think so. I don't know where you're headed.
So if there is a webpage, if I go to University of Mississippi Medical Center's website that talks about home care after tonsillectomy, and it says that children, there are no strict rules for activity after surgery other than to avoid contact sports or heavy exertion for about 2 weeks. Would you have any reason to disagree with that?
I would disagree with that. I would think one of the side effects of tonsillectomy in children is dehydration. You don't want your kid out there playing in the summer heat after tonsillectomy. That would increase their risk of dehydration if they get to where they can't swallow it.
So you're more cautious with children than you would be with adults.
No, I'd probably, adults, I'd be cautious with adults and children. I don't think heavy exertion after tonsillectomy would be a good idea, in my opinion.
For up to 2 weeks, or do you think that information is
Probably at
wrong?
least 2 weeks.
So if Mr. Chambliss had gotten a tonsillectomy on August 1st, or anywhere between August 1st and August 7th of 2022, he's out for 2 weeks, correct, from contact sports.
Correct.
He's out for maybe 2 weeks from classes, correct?
2 or 3.
But we know that classes didn't start till August 29th, 2022.
That's what you're telling me. So I don't know.
Correct. And do you know when the first game Ferris State played was in 2022?
I have no idea.
If it was September 1st of that year, do you have any reason to dispute that?
The problem with getting your tonsils out, you're going to miss 2 or 3 weeks of practice. You're also going to people Trinidad's age that have their tonsils out usually lose about, I tell my patients, tonsillectomy is a guaranteed diet. You're going to lose probably 10 pounds. And for a college athlete in August to lose 10 pounds before the season starts and be out of practice for 3 weeks, I don't think he's going to play in the first game of September 1st if Andy Thompson doesn't want us. I don't think that's a possibility. If I took it, if he still had his tonsils, I took him out even after last year, in August of this year, I'm not sure he'd be able to start the first game next season. Even though he's a returning starter, I think he'll be too hard to recover.
Do you know when Mr. Chambliss first resumed heavy exerting activity after his tonsillectomy in 2024?
I do not.
Do you recall looking at a note that was a medical note about 11 days later that said he was doing well?
Saw that.
Was there anything in that note that told him not to participate in any kind of exercise or competition or anything like that?
Not that I saw. That was, I think, a physician's assistant doing the follow-up. And once again, these notes are electronic medical records, and sometimes in electronic medical records, you have to kind of read between the lines, and some of them are better than others. And
I'm with you there.
yeah, I mean, EMR is not always, if you saw one of my notes, I would have been very clear. But once again, too, I don't think anybody at that time had any idea that these notes would be looked at under a microscope like that. It was just, there was no way to predict this.
Right, 100%. And this is not casting aspersions on anybody.
Yeah.
But when you agree with me though, that when you've got a record that is
I'm just telling you, I've done a lot of tonsillectomies over 26 years. And if he had come here to Mississippi and had him out, and I'd done it in January, I would have told him at least 2 weeks, don't do anything heavy lifting strength. That's what I would have told him.
2 weeks.
That's what I would have told him.
How long
That's
is
what I
football
do in my practice, and I've done it for a long time.
Do you know how long football season is?
What's that?
Do you know how long a football season is?
Yeah, it's like, it's the whole fall.
Longer than 2 weeks.
I understand that.
Significantly, right?
Correct.
And back to the question I started a moment ago, though, you'd agree with me, though, that while we're not saying anybody's done anything wrong with respect to documentation, when there isn't specific information included in that documentation, it just leaves us to speculate as to what might be needed to fill those gaps, right?
But it does, and I work in a Division I school, a town, and I don't think the Division II schools have the resources, probably a Division I, you're in some lawyer, they probably don't have the resources at Division II school to dot all the i's and cross the t's that they would at a D1 school. They probably don't have a dedicated person whose job is to make sure all that documentation is done, where Ole Miss probably has 5 of them.
And that leaves you, a doctor at a Division I school, left just to speculate as to what could have happened here, because there's not enough information for you to know for sure what the situation was.
I can't know for sure, but I'm looking at the whole picture. I'm making an informed decision.
Yeah, based on your experience.
Interpretation, yes.
Based on your experience.
And my conversation with Trinidad and his mother, and reading the records, and reading Dr. Howard's note and other notes.
I don't believe I have any question. Thank you.
Can you read the record?
Yes, Your Honor.
I'll reinvent the wheel.
I will not. May I approach the witness?
You may.
Dr. Dodd, we got some advanced medical records here that you reviewed. I want to pull up this page. Okay. You were saying something about electronic medical records don't always read very well.
Yes.
Why is that?
I get electronic medical records sometimes from a referring physician, and I can't tell what's going on.
Okay.
Some of them are better than others, and some of them, but also with EMR, you look, it's his first thing is the impression. And I'm pretty good at documenting what I do. And if you read one of my notes, if y'all lawyers out here, if you read one of my notes, you would know what I was thinking. And I think in that December visit, I've said, Trinidad is doing better. He's not completely well. We discussed our options at this point, continue medical management or consider getting his tonsils and adenoids out. I discussed the risks of this. Anyway, that's I said, but go ahead.
Why you said the words medical management, I want to ask you this question before I get you into this record. If Dr. Howard had said on August 1, 2022, you need an operation, let's do it tomorrow, okay? Is that a complete abandonment of a conservative medical approach?
I would have, he mentioned here, try to do it over Christmas break. If I have a college student in my office that has chronic tonsil problems, especially if they're, I always try to get through the semester before we get the tonsil adenoids out. It's just, that's just now, if they have an abscess or something that comes up that sometimes you can't, you have to bite the bullet and do it, but I mean, most ENT doctors would not perform a tonsil mammectomy in early August at the beginning of the school semester, whether it be a elementary school student, high school student, or college student, especially not a college football player.
Do you know whether or not, the NCAA rule book, which is about 400 pages long, hang on, listen to the question. Do you know whether or not this 400-page long rule book defines the term? Yes, sir.
I have not read that.
All right.
I don't plan on reading it.
Do you know whether or not that book defines the term incapacity?
I do not. I have no idea.
Would you be shocked to learn that it does not?
Probably not.
That's a word, just common English usage, right?
Yeah, there's a lot of variability there once again.
Okay. Let me now ask you about this medical record. What I have for you is the electronically recorded medical record from Dr. Howard on August 1, 2020.
Okay.
Now, mechanically, how do these records create if they're electronic?
Some of it, you can type in, some of it you transcribe in, and some of it's like auto-generated by your nurse puts in what they're, and it's a kind of a combination of all of it, and some of them are better than others.
All right, if it's a voice recorded one, and I think there's some stamps on those records that say they are voice recorded, does the recording catch every word somebody says?
No.
Okay. And so whatever the recorder picks up is what gets printed in the record, right?
Correct.
Okay. I underlined a particular sentence and bracketed it for you just so you could identify it in that August 1, 2022 medical record. And I can't understand that sentence. Can you understand it? It doesn't read very well.
Want me to read it for you?
Yeah.
We discussed the role of adenotonsillar hypertrophy in his nasal congestion obstruction, as well as snoring, as well as its more significant effects on his school and recurrent illness.
Okay. So on August 1, 2022, Dr. Howard made reference to some kind of effect that his conditions will have on his school.
It looks like it.
Even though it doesn't read great, we can't really understand what he's saying. He uses the word school, right?
Yes.
Was Trinidad sick in the summer of 2022?
Obviously he was, but that was before this visit. So, reading what Dr. Howard's saying, that he felt that he needed his tonsils and adenoids to get better. And he would not have said that if he hadn't been sick all summer with recurrent infections and probably obstructive breathing.
Do you know whether or not Trinidad's summer in 2021, 2022 correlate with the exact period of time he's expected to be training, conditioning, and get in athletic shape to play football?
Yeah, he was in the ER in March of 2021, which is basically 1 year ahead with chest pain, palpitations, and shortness of breath. I think it was probably long COVID.
Would you be surprised to learn that the NCAA publishes something called a sports medicine handbook?
I have no idea about that.
You've not looked at it?
I have not.
Let me just ask you about something in this handbook and ask you if it makes sense to you. Okay? There's a section of that handbook on training and conditioning. And what it says is that training and conditioning to get into shape for a college athlete is the athlete's responsibility before the preseason starts. Okay? And then it warns the athlete that if you show up in an undeveloped state, you are heightening a risk of injury to yourself and your teammates. Does that make sense to you?
And Your Honor, just for the record, I'd like to object. I believe this is outside the scope of cross-examination. We didn't go into anything. He testified that he didn't know what the rules were, and so I think having him opine on what the rules are and what they say at this point is important.
My response is I'm giving him a hypothetical that happens to be based in fact, and he's a medical doctor, and I'm asking him as a doctor, would that make sense to him? And by the way, it is responsive to cross-examination because they cross-examined him on the issue of incapacity without taking into account when he's incapacitated and when it would affect him.
What incapacity? stated means. And Mr. Askew, you asked him about his medical situation, and what he read, what the record said. I think he's trying to have an opportunity and be direct to address that, so I overrule him.
Appreciate your, thank you.
I'd like to continue. Your
You
Honor.
may.
Okay. Dr. Dobb, let me ask you one final thing about this letter you were questioning about from Sarah Higley, who, by the way, says she signed it, Sarah Higley, Senior Associate Athletic Director of Fair State University. Okay? And counsel opposite had you read the sentence. I want to read it again. Okay? Sentence says, the decision to redshirt Trinidad in fall 2022 was based on his developmental needs and our team's competitive circumstances at that time. Do you read this letter to imply anything about Trinidad's status of development at that time?
It says, I mean, his developmental needs, which obviously, if his development wasn't where it needed to be, that would adversely affect his ability to compete.
And in your opinion, based upon reasonable medical probability, did the illnesses that you testified about today impact his development as an athlete?
Absolutely. I think it'd be, trying to go out there and run a marathon without training, that'd be hard to do. And playing college football is a very demanding activity, and if you can't train and compete, you're chronically tired and fatigued, I don't think you're gonna be ready for that.
Give me 1 second, Your Honor. Confer with co-counsel. We don't have any further questions for Dr. Dodd, and may I ask, he's got clinic this afternoon, may he leave?
I'll get through with it. You can't.
Yes, sir.
Dr. Dye, having played football myself, it's not a good idea to wait till the time you go report to camp to be in shape to play, is it?
Not at all.
And if he was seeing Dr. Howard in early August, then I think he'd seen his family physician, Dr. Dystrin, or whatever her name was, before that. She noticed he had enlarged larynx and adenoids, and she referred him to a specialist because she thought he needed something special.
Correct.
In early July of 2022, before this whole thing
I think he
about,
was sick that whole summer.
and referring to his rules, they've admitted these rules in the evidence that the NCAA recommends that you get in shape in the summertime before you report, so you won't have these problems. But he wasn't able to do that in 2022, was it, based on your
I don't,
medical analysis?
I do not think so.
All right. And as far as you know, the NCAA has not reported to you or your lawyers, the lawyers for Trinidad, that they had some medical doctor or ENT review the records in making this decision that they made to deny the waiver in 2022. You hadn't seen anything like that?
Not to my knowledge, no, sir.
It's not brought to your attention. Would it have been fair and reasonable to have Trinidad records reviewed by some independent to determine if they believe to a reasonable degree of medical certainty that he was not able to participate in 2022? Would that not been fair and reasonable in your opinion?
Yes, sir.
And all the opinions you've given here today, are they based upon a reasonable degree of medical certainty and probability?
Yes, sir, and years of experience dealing with it.
You may be excused.
Thank
You're
you.
free to go. Who do we have as the next witness?
We call, Coach Joe Judge, Moments Football. May I proceed, Your Honor?
You may.
All right. Coach Judge, thank you for coming today. Appreciate that. Let's get this out of the way right now, early. Are you close with Trinidad Chambliss?
I am.
Are you fond of Trinidad Chambliss?
I am.
What do you think about Trinidad Chambliss as not only a football player, a human being?
Well, the second part's more important. I think the world of him as a young man, for the kind of person he is, for how genuine he is, for how he brings people together. I hold him in the highest regard.
All right. Thank you, sir. Currently, where are you employed and what is your job title?
University of Mississippi football. I'm the head coach for the offense and the quarterbacks coach.
When did you start work at Ole Miss?
April 2024,
Where did you obtain your undergraduate degree?
Mississippi State University.
Okay. What was your degree?
Got a history degree in 2003. Got a master's degree in instructional technology. I believe it finalized in 2005.
Okay. When did you begin your first coaching job? Or I may call it a gig, I mean a job, okay?
Same deal. So when I finished playing, I stayed on the graduate assistant at Mississippi State. Was there for 3 years. Coaching every season since.
Okay. Did you coach at Birmingham Southern?
I did. For 1 year, I was a linebackers coach and special teams coordinator.
Is that a member institution of the NCAA?
It is no longer in existence. It was a Division III school.
It was a division.
I was there during the second year they ever had football, or second year they brought back football, I should say.
I understand. After that job, did you make a jump to a Division I coaching position?
I was employed at the University of Alabama for 3 seasons, 2009, 10, and 11. I coached Saban.
Okay. Let's go to 2012. Did you make an even larger jump to the NFL?
I did. I began in 2012 in May with the New England Patriots.
Okay. What were your responsibilities? Well, how long did you work with the Patriots?
Well, I was there my first stint from 12 to the 19 season, and then I returned for the 22 and 23 seasons. During my time there, wore a variety of hats. I entered as the assistant special teams coach, became special teams coordinator, coached wide receivers, coached the quarterbacks. I was assistant head coach. I was primarily in charge of all player development responsibilities. I was a primary liaison to the personnel department. The way Bill works, the more you can do, the more he gives you. So as I was there, he kept throwing more on my plate.
Talking
So
about Bill Parcells.
Bill Belichick. So.
Bill Belichick, okay.
Did you get to coach Tom Brady?
You know what? You're in a room, you learn a whole lot from Tom Brady. So being around Tom, to say that you're coaching Tom Brady is a loose deal. Josh worked primarily with him during that time. But to be in there and learn from Tom was tremendous.
Okay. Thank you, sir. During your first stint with the Patriots, from 2012 to 2019, did you have any responsibilities for player development?
Yes, all of them. I was primarily responsible from 2015 through 19. Then again, when I returned in 22 and 23, I was the director of player development, which to define that, what that means, look, I'm the first face you see when you get in there. Whether you're a new free agent joins the club or you're a rookie we draft, free agent, sign, whatever it may be, my job is basically to get you acclimated within the organization. And for a young player, the first thing we're doing is teaching you how to be a pro, which is a significant difference from being a college football player and a professional football player. And our job is to get you up to speed with what you have to do. Now, that entails everything from how to study film, how to identify personnel, how to review and take notes, and then also a large part into how to train, how to physically recover, the importance of taking care of your body. It's your main vehicle. It's really, without your body being full ready to go, honestly, you're useless as a professional athlete.
Understand.
So, can you slow down just a little bit? This lady's taking down everything you say,
Yes, sir, Your Honor.
and it might be moving at a little bit fast speed.
Where are you from originally, Coach?
Philadelphia, Pennsylvania.
You've been here long enough now to know we talk a little bit slower. Right.
I'll do my best.
All right, thank you. You were, for a period of time, the head football coach for the New York Giants.
That's correct.
Okay, what years?
2020, 21.
And then after you left that position, go back to the Patriots?
I did. I returned back to Foxborough, took on the role of assistant coach, quarterbacks, coached all the special teams, again, player development, managed a number of other departments.
Well, here's a good question. How did you end up in Oxford, Mississippi?
Roundabout way, I came down for a visit. I completed the 2023 season, quite honestly. I was burnt out in the NFL, and I was going to take a year off. And that was great until about March, till I was rearranging kitchens and undoing garages. My wife got sick of seeing me every day and said, you need to get out of the house and go visit. And I've been flirting with the idea of college football since I've received a few calls throughout the years about I'd be interested in their job. And I decided to get out and visit some schools. I had scheduled 10 schools, and the first school on the stop was Ole Miss. Primarily wanted to find out what this school was doing that was making them so successful. I'd been in Mississippi for a period of time at Mississippi State. You know, at that point in time, both schools were kind of very even. It was kind of one school was up, one school was down based on the roster in years. And in recent years, Ole Miss had really just climbed far ahead, and I wanted to see what they were doing. If I was going to get into college football, I wanted to learn the NIL and all things that were coming with it. I came down for a visit, kind of like Gilligan's Island. It was supposed to be a 3-hour tour. I didn't get talking to staying, and I've been here since.
You know, they say this about recruits, that if you don't want to come to Ole Miss, don't visit Oxford, right?
Absolutely.
The same applies to you then?
I moved my family down here. They're fully embedded in Oxford, so needless to say, we love our time.
Thank you. Your Honor, practiced law 30 plus years, and I've never had the opportunity to offer this kind of expert to the court, but I offer Coach Judge as an expert in football and quarterbacks.
Your Honor, we would lodge an objection to the extent that's an undefined science, and there's been nothing in the record that his knowledge is anything separate and apart from what could be understood from other football personnel. Moreover, there's nothing to say that what he's about to testify has been peer reviewed or generally accepted, or that there's even a scientific method that you could apply a quarterback to that could be tested by anything. But we, subject to Your Honor's ruling, we'd just like to lodge that objection.
I kind of tend to agree with you on this one, that this is not something that is, been some type of scientific science. It's been laid groundwork for somebody to testify in this area as an expert. I think he can give lay opinions as to what he's experienced and so forth in these areas, but as far as labeling him as an expert, I'm not going to do that to him.
All right.
Your objection is sustained.
Thank you, Your Honor. I'll ask him for lay opinions. All right. Coach Judge, you're familiar with the process of an NFL draft, aren't you?
Yes, I am.
I mean, you've actually participated in that process.
In my role as an assistant coach, start with special teams, you're primarily responsible for every player in the draft. Every player, offensively or defensively, you have an opinion on. Okay, and what you find out is there's different levels in the National Football League. Everybody has an opinion, and only a few people have to say. I was able to have a strong enough opinion. I eventually graduated into one of the people who has a say in the organization. But every player that was in the draft that came up in a draft meeting, the offensive or defensive position coach, the coordinators would speak, and then I would give my opinion, where they would fall in suit and how they would help us in the kicking game. That's a very big phase in the National Football League. It's a little bit different than college. It's grown the importance. As I developed on coaching wide receivers and quarterbacks, I had more of a say in the organization by that point in terms of having the ability to help rank the players on the draft board and be within the draft room. Some clubs have everybody in what they call the war room, the draft room. We did not do it that way. We had about 6 people in the draft room, and you had to kind of work your way into those 6 people, and that's outside of the ownership that was in there as well, be part of the draft. When I was the head coach, I was primarily responsible for the draft along with the general manager. Wherein that there's 2 people in the organization who have a say, the general manager and the head coach. They're responsible for all the players in the draft, of understanding how they fit your roster, how they develop, and how you build your team going forward. So,
And because a general manager and a head coach's job can be on the line if they draft poorly, does a lot of work go into the analysis before a particular athlete is selected at a particular draft position?
absolutely. Absolutely.
What type of work, in order to form an opinion, if you're in an NFL team, the general manager, head coach on that team, if you want to form an opinion about who you want to draft and where, what kind of groundwork has to go into that?
Well, first is the film work. If the film is good enough or there's some kind of physical trait that you see as developmental worthy, then the film will go ahead and lead to more things. The scout's job is to go out there and kind of be the recon guys on the ground, come back with information. Go to the schools, watch them practice, see them playing games, and come back with information so you can go ahead and use that evidence to make a decision. All right, once you determine somebody is good enough to qualify to staying on your draft board, right? Because the first thing you look to do in the draft is eliminate people. There's too many players. The first thing you do is you go through names and you have different qualifications of eliminating people off the board. All right. Once you say that someone's on the board, you start doing a deeper dive. And that entails in-person interviews, visits to their college campus, pro days, individual workouts, bringing them up to your facility as part of the couple 30 visits in the NFL of guys you can work or interview in your facility primarily. There's countless Zoom calls and phone calls and research being done. There's a tremendous amount of research done to each player you select.
Would part of that work include communicating with decision makers on NFL teams and determining how they view a player?
For right now, if I were to go ahead and determine who's going to draft, yes, I would have to reach out and talk to the decision makers in the NFL, the GMs, the head coaches, many of which I have very good relationships with. But I would have to reach out to them and do the research on the work they've done before they see a specific player.
Okay. Have you done any of that, the reach outs to the NFL with respect to Trinidad?
I have not.
And in order for you to form any opinion about where he might be drafted if he was forced to go into this year's draft, you'd have to do that work first, right?
For me to make my own personal decision,
Yeah.
I would. First off, you have to look at each individual player, and then you have to study the entire draft. Because to assess where somebody is taken in the draft, it's not just about what you think of them as a player, or they may fall within their own position category. It's what's the rest of the draft look like. So if you want to talk about someone's the top wide receiver in the draft, and someone may say he's a first round receiver. Well, that goes into what's the volume of receivers available. What are the other 32 players that may go in the first round ahead of him? What are the needs of the league? There's a lot that goes into this, purely by saying this guy is capable of being this round. All right, great.
It's going to sound like a really dumb question. How important is development to an NFL player and a collegiate player?
It's critical. It's critical. You have to show constant improvement. I'd say, as it relates specifically to a college player.
Yeah.
All right.
Yes.
Development is paramount, and here's why. When you get to that level of the NFL, every rookie that walks in the door, I don't care who you are or where you're taking, every rookie that walks in that door is miles behind every vet in the building already. Okay? Your only true value when you're a young player or rookie on a rookie contract is you're young, you're healthy, and you're cheap. That's the reality of it. That's why you hear so much talk about quarterbacks on rookie contracts and how it ties in the rest of the roster build. So your development in college gives you the best head start possible when you get on that facility's campus to start competing against those vets. There's only 53 spots on the NFL roster. Okay, there's only so many kept at each position group. You have to take someone's job in order to have a job. And the guys who are already in the building, those vets, they are physically more prepared for you. They know the duration of the season, how to train their body, how to recover, how to deal with ailments, how to stay ahead on preventative medicine. All right. They are mentally far superior to you of understanding the league and the personnel of what it is, because that league is all about people. Schematically, what they have to do, how to study a playbook. You're so far behind the rookie, you don't even know where to start. Okay. So your greatest value, like I said, is young, healthy, cheap. So when you get on that campus, I'm talking about the organization's campus, you have to have such a head start to run that race and catch up to people that if you're starting at ground zero and you're behind, it makes it virtually impossible to compete with grown men in front of you. And that's just the reality.
Does playing the position of quarterback well entail both physical attributes and mental attributes?
Absolutely.
Okay. I think we all kind of know what the physical attributes are, but let me ask you about the mental attributes. Is that just as important as the physical attribute?
In most cases, more.
Okay, will you explain that, please?
For playing a quarterback, You touch the ball every play. You have the organization's future every play in your hand. Okay? It's the quarterback's primary job of keeping the offense moving efficiently. All right, and that means positive plays, which means you have to have a base understanding of how the defense operates, what you're being presented with, how to keep the team out of negative plays. You have to have an overall knowledge of your offense and system that you can fix problems within the system before they happen post-snap and become an issue. You have to have a knowledge of the personnel you're playing against. You have to have a knowledge of the scheme that they're playing. It all ties together. So playing quarterback, the mental aspect of it, if you can't mentally operate, you can't function. There's a lot of really smart guys, okay, who can tell you what the offense is supposed to do that can't do it on the field. Normally they're called coaches, okay? And then there's a lot of talented guys physically, all right, who are not playing at a high level either of college or the NFL, and that really reflects into, their inability to process. When you talk about the quarterback position, it's about identifying issues, identifying defensive schemes, identifying, what you have to do, and then post-snap, all right, it's about processing. Immediately seeing what the defense presents to you, making the right decision, and doing it while there's live balls. So the mental aspect of playing quarterback, it's not just about knowing what to do and being able to sit in a meeting and regurgitate what it is, but it's about going out there at full speed and instinctively processing as you go through it.
So I was going to ask you about that rapidity, right? How rapid do these decisions have to be made in real game situations by a quarterback?
I mean, instantaneous. I mean, you look at the average, I don't know the exact number right now, but you talk about the average drop back pass, that ball's getting out of there in under 3 seconds. So in under 3 seconds, you've got to, process, what the defense is doing, where that takes you in your reprogression, where you have to go, and then you have to physically execute making the right, throw accurately and avoid contact.
Is that sort of mental development that we've been discussing for quarterbacks equally or more important than the physical development?
I would say so.
Okay. Does Ole Miss have something called a quarterback school?
We do. We
Right.
do. We're actually starting it right now with our quarterbacks. We should have done it a few weeks ago, but the ice storm has been delayed.
Okay. Tell us about the quarterback school. How long does it last? What do you do in the quarterback school? Who attends it?
So the quarterback school is for every quarterback position. And what we'll do is we'll actually vary and stagger it based on the experience level of the quarterback. If it's an older vet in the room, we may go a little bit faster. So he may go on his own or with another older quarterback. Whereas the freshmen come in, who are a little bit slower pace, may segment them off as well. Typically it lasts multiple weeks and probably up to a month when you're all entailed everything. But what quarterback school is, we're just teaching you football. We're going to teach you everything about a defense that you can possibly learn so that you understand as we're installing plays, as we're talking to you about different coverages, different fronts, different issues, you're speaking the same language as us, okay? And part of football is learning the language. That's really what it is. Everything's code for something else. So we get in there, and Trink can tell you, hey, we start out, we're going to talk about fronts, how the defensive line is aligned. And we're going to talk about front movement, stunts, and we're going to talk about blitz patterns, and we're going to talk about coverages behind it, and blitz coverages. And we're going to talk, sorry. And we're going to educate the quarterbacks on everything they need to know about football because they are the extension of the coach on the field. They don't have the luxury of going out there and having half the information. They have to go out there and have the entire thing fully prepared so they can fix the problems. So the quarterback school for us is we're teaching them all the terms that they're going to possibly know before we really jump into it. And then we'll start with our own scheme and install our playbook.
Right.
All right, let's stop right there. You're the coach out there, and I'm the manager of the coach of this outfit right here. Where are we going with this?
Okay.
Let's move on to somewhere that's.
Yes, Your Honor. We're getting there really quick.
All right.
Okay.
I don't know all this, I need to know what's cover two, what the line's doing.
I understand.
I've done that in a while, about 40 years.
I will tell you what this is about.
Well, go ahead.
Okay. What this is about is what's in Trinidad's best interest at the present moment, which is a factor for the considering granting an injunction. So, Coach, did Trinidad get to attend quarterback class, or has it gotten a chance to attend it?
When Trinidad got here last year, it was after they used to have the second portal window. So we didn't get Trin until the very end of May. And what his exposure with us was, we had him for the very end of May and June, where he basically got a crash course on our offense where primarily he was trying to get caught up as much as he could on just our system. And that's the nature when you get there late. You don't have the luxury of time. In July, coaches go away. So we really had him for most of June, not the entirety of June, most of June. And then didn't really see him much in July. And then we get back for training camp. So in terms of did he have the full luxury of going through the entirety of quarterback school? No, he did not.
Is another year of development for a college player, and particularly a quarterback, something that should be encouraged?
Absolutely. It is definitely beneficial. The more you can play, the more experience you gain, the more knowledge you have, would definitely benefit your development to get you to the next level and be able to have success.
Have you ever heard the terms demonstrated consistency?
Absolutely.
What does that mean?
Demonstrated consistency in the football world is being able to take the tape and see someone perform at a high level consistently over a period of time, multiple years.
Okay, multiple.
Yes, sir.
Have you ever heard the term a one-season guy?
Absolutely.
What does that mean?
A one-season starter would simply be a player or a quarterback in this instance that was only a one-year starter in major college football.
When you were in the NFL, what was preferred? Athletes who had played over multiple years and demonstrated they could at a high level, or a one-season guy who might be a flash in the pan?
No, absolutely multiple years. And what you're looking for when you draft somebody is it's an investment, right? You're allocating an asset. The higher the draft pick, the higher the asset. So when you're going to go ahead and invest that asset into somebody, you're looking for sustained evidence, like you would in any investment, that there's going to be growth. If it's a one-year sample, you're making a large jump on a leap of faith, as you refer to it, flash in the pan. Over the course of time, where there's more years developed, the development of the quarterback, gives you a better vision of what he could be, where he is at, and then also, as I referred to earlier, when he gets to your team, he's further ahead to be able to compete and help you.
Have you taken a look at some data about NFL quarterbacks and their performance over the last 10 to 20 year time period, and asked yourself the question, which of these quarterbacks were one-season guys in college?
We have, yes.
Okay. For the majority of the quarterbacks who've been successful in the NFL over that time period, were they one-season guys?
Well, there are multiple season guys. And when you define success, what does that mean? You can talk about individual success, team success, or as professional financial success.
Let me ask you some questions. Answer it from the research that you did in preparation for today. If we're talking about individual success of a quarterback in the NFL, over the past 20 years, how many NFL quarterbacks who started only one season in college in Division I?
There's one. It was Cam Newton, who the anomaly of Cam Newton is he was also a Heisman Trophy winner, national champion, the first overall pick, and had some traits you just can't coach. I can't coach somebody 6'6", 250 running a year. I just can't.
Okay. Let's talk about team success. How many quarterbacks over the last 10 years played only 1 year in Division I college, but had the opportunity in the NFL to start for their team in the Super Bowl?
The only starting quarterback in that time frame in the Super Bowl that was a one-year starter in Division I, again, Cam Newton.
Okay. Let's talk about financial success. How do you define financial success?
What you're looking at is an investment of stability for the team and for the player. So after their rookie contract is complete, we looked at all the quarterbacks who had signed extensions or with another team as a free agent of 3 years or more.
So we're talking about the second contract that player into.
Correct, which is the most important contract you can have in that league.
Okay. All right. Over the last 10 years, how many quarterbacks in the NFL who only played 1 year in Division I college ball signed a second contract with an NFL team that was 3 years or longer?
There were three technically and truly two. So Kyler Murray, again, first overall pick, Heisman Trophy winner. Brock Osweiler with the second round pick. And then you had Ryan Tannehill, who's also a first round pick. And the exception to Ryan Tannehill is he had one full season start, and the season before he started the back end of the season, the last 5 or 6 games.
So in the last 10 to 20 years, given these parameters of my question, guys who played in the NFL quarterback but only played one season in college, of all the quarterbacks that played in that time period, there's only 4. Correct. You talked about athletic development. Part of that involves the player's health, correct?
Absolutely.
What are the 2 necessities for a player to be in good health so that they can play football?
To be in good health, well, one, you have to be trained. Your body has to be in peak condition. So you have to be physically prepared. And along with that, that comes the nutrition element, that comes the rest and recovery element. And that's really the part of, getting you ready to perform.
Okay. Between nutrition and sleep, which of the 2 is more important for an athlete?
Sleep.
When you were working in player development for the Patriots,
Yes.
did you have opportunities to educate players or consult with players about their sleep patterns?
We invested a great deal of time and assets specifically on our players' sleep and rest and recovery. So we ended up bringing this back after doing some research with the Navy SEALs, and we talked about sleep and how it correlates to cognitive function, as well as physical recovery and injury prevention. And after that research, we ended up going out and we got those sensory deprivation sleep pods. It's the saltwater tanks you float in, and what it does is it puts you into a deep sleep and resets your sleep patterns. We had one for the first season, we had that, and then immediately returned and put an addition in our training room and added multiple. So we not only invested financially, and you have to ask Mr. Kraft what the bill on that was, of adding a number of these things which are not cheap, but new facilities to house them as well. We invested a significant amount of time educating our players on it, as well as tracking their sleep with our nutritionist who acted as a sports scientist, Ted Harper, and making sure that they were fully rested and then working with them if their sleep patterns were disrupted. And that would include when we practiced on the road, which is common in the NFL. If you have like 2 West Coast games in a row as an East Coast team, there was a time we practiced day of week in San Diego. There was another time we practiced day of week in Colorado before we went and played the Mexico game against the Raiders. And at both those instances, we found facilities in the cities that had those sleep deprivation tanks so we could transport our players to them because it was important enough for us that they kept their sleep patterns regular for recovery. And just kind of give you in terms of the health part of it, we would educate our players on when it comes to soft tissue injuries, talking about hamstrings, glutes, groins, things of that nature. That is something as an athlete that is preventable. And we would tell them the formula for preventing is, number one, you have to be in shape to do your job, conditioned, and fully ready to go. You have to be fully recovered, rested, and have the right nutrition and hydration to be ready to go. And then you have to be warmed up properly. They were really the things you could do to control it to prevent those injuries.
Gotcha. You ever heard a saying that bad players get good players hurt?
I've used that saying more than you can count.
What does that mean in the context of this case, where we're talking about, medical illnesses, sleep apnea, not having enough energy in the daytime? What does that phrase mean in the context of this?
Generally speaking, when somebody is moving at a different speed than the rest of the people on the field, that they can't go that full speed level, that's when you get someone who's on the ground, off balance, out of place, and guys who are moving at the correct rate end up getting hurt. Someone falls on someone's legs from behind, they can't keep on their feet, there's bodies piled up. That's when, quote, bad players get good players hurt. And that comes a lot of times from when players are not fully conditioned, that as you get to the end of the practice, their legs start to give, they can't fully stay up and compete, and all of a sudden the guy who wasn't fully prepared gets the guy who's out there trying to compete at full speed hurt.
Can a sleep disorder make a player bad or increase his risk of injury or injury to a teammate?
Your Honor, I'd object to the extent this is calling for a quarterback's coach testimony on what medical issues with the respiratory system cause on the football field.
It's based on his personal experience, what I'm asking about.
Repeat your question.
Yeah. Can a sleep disorder affect a player's ability to perform?
Quite simply, yes.
Okay. Has that occurred in your past where you have encountered players with sleep disorders?
Yes.
Okay. And what did you do for those players?
But we got them the CPAP machines, we track their sleep. We make sure that they were evening out their sleep cycles, that they're properly rested. That was several players over the course of years. And then there was also the players but we would have to educate. This is always a tough conversation to have, and it's not gonna be a popular thing, but this is the truth. We would have to educate significant others who may have been pregnant during the season, or gonna have a baby during the season. And you'd have to educate them on, you have this baby in the middle of the season, that father has to play good football, right? It's a day-by-day production business. He has to be ready to perform and go out there and play. And when I say that is, you need to let him sleep. He needs to be in another room, detached. You have to explain to the mother, like, hey, listen, he ain't waking up for midnight feedings. After the season, he's full metal jacket. You do whatever you want with him. And he can change every diaper. But in season, he's got to have a different priority. Now, there were examples to use from that. We had some older veteran players. I can or can't share names if you want me to, who had multiple children, who would sleep in other rooms. The wives bring in family or a nursing aide to help throughout the night. And those players continue playing high-level football. We had other players who were younger, who quite simply did what every other father in the world does, waking up, changing diapers, doing feedings, and led to injuries, led to soft tissue injuries, not being rested, not being recovered, or not being ready to roll.
That never occurred to me that newborns can affect injuries on the football field. But who had to deliver that message?
Sadly, me.
Okay.
Which is
And to whom did you deliver the message?
to the women, the pregnant women.
Oh, my Lord. How did that go?
About as good as you could expect.
All right. Let's talk about a trend in the NFL if we can right now. And what I'm asking about is the rush to play quarterbacks early after they get drafted, right? What have you noticed the trend is?
The timetable for development in this league, and really every league now, with the way people are jumping back and forth, the timetable for development has just almost been eliminated. And the immediate usage and immediate return on investment has just been amplified. And quite frankly, when you're drafting a quarterback, okay, you're only drafting for a position in need, you're only drafting someone to come in there and play. And you got to get that guy out there. The ownership, the media, the fans, they want to see a new guy. They've been looking forward to seeing this guy that you've drafted. They've watched his college tape. They know he's an exciting player, and they want to get him on the field and they want to see him. So there's a lot of pressure to get guys out there fast.
Okay. Are there quarterbacks that you're familiar with who weren't rushed into a starting position in their first year, got a chance to sit and learn and develop?
Yeah, absolutely. In terms of improving their development with the timetable, I mean, you can look at the high-end examples of Aaron Rodgers, who got to sit behind Brett Favre, learn the league, develop. Bill Green Bay does a great job with that. Jordan Love, right behind him. Patrick Mahomes got to sit his rookie year. The return on investment of extending out that development window is huge.
Would it be in the best interest of a college quarterback who one day anticipates going to the NFL to get as much development as he can on the collegiate level, because he might not get that opportunity in the NFL?
Yes. Today's football, yes.
You read sports media?
I try not to.
Okay. No offense to anybody here, all right?
No offense. Hey, listen, I learned a long time ago. You start reading that stuff, and everyone wants to believe the good. Well, you believe the good, you better believe the bad. So,
Okay. Well, you're aware that every year there's a whole business built around prognosticating draft picks.
Right.
Okay. And we know names like there's Mel Kiper and Todd McShay, and there's other people that do this for a living. What value do you give a journalist's prediction as to draft status or draft round or draft number of college athletes?
It's for entertainment purposes. You got to take it for what it is. Just entertainment.
Sometimes are those prognostications terribly wrong?
Yes.
Can you think of one in recent memory that is terribly wrong?
I don't think this reflects what he could be as a pro. But I think you think back to last year, Shaquille Sanders, who was almost guaranteed by the media to be gone in the first 5 picks. Okay, and that narrative was sold to everyone along the way, and he had to sit there and watch round after round go by. That doesn't reflect what he's going to be. But again, the guarantees of where they're going to fall, again, they don't have all the information. And when you talk about all the information to make those picks, even within each organization itself, there's only a small circle of people with the information of what's going to happen. Everybody else gives information. They have their opinions. Then the inside circle has a say and they make the decisions. If you talk about like mock drafts right now, like what's out there right now, you're making predictions without any of the process taking place. We haven't had a combine. You haven't had in-person interviews. You haven't had the medical review, the psych reviews. You haven't had pro days. You haven't had individual workouts. You haven't had visits to the NFL facilities. The entirety of the process really hasn't even began yet. It really hasn't even began yet. So to make a prediction on where someone may or may not go at this point in time, you don't have the information. You don't have the inside information of what you would need to actually know what's going to happen.
Final subject matter, okay? Heisman Trophy. Are you aware that Trinidad got votes for the Heisman Trophy in 2025?
I am aware of that.
Do you know where he finished in the voting?
I believe he finished 8th.
Had you reviewed the list of the 7 persons that got more votes than he did?
I have people, yes.
All right, where are 4 of those people right now? We got votes higher than Trinidad.
They're going in the draft. They're no longer in college football.
So next year, if he's at Ole Miss, he won't have to compete against those 4 people, will he?
That'd be correct.
Do you think that Trinidad, if he plays next year at Ole Miss, stays healthy, performs at a high level like he did this past season, has a reasonable, non-speculative shot at winning a Heisman Trophy?
I believe it's a fair statement in terms of where he finished after this year, in terms of he did not play a full season this year. And in only 10 games out of the 12 season regular season, he started and performed at a very high level for us, enough so in the SEC that his numbers are among the top, and then he finished 8th in the Heisman voting.
Okay. Do you know guys who won Heisman Trophy?
I was at Alabama with Mark Ingram when he won in 2009.
Is a Heisman Trophy for the recipient of one a life-changing experience, even if they don't make it in the NFL?
I believe so. I believe so, just on a reflection of the doors it opens, the contacts it makes. I would say not even just winning it, but being involved to that level. It's just such positive publicity for somebody that they go out into the real world with their name, resonates with people when they go in. The doors that will open, whether they want to go into a sports field or any other field. And to me, the Heisman Trophy, along with probably heavyweight champion of the world, is probably the most prestigious individual awards you can have.
And the guys who won Heisman Trophies end up being sports commentators?
I'd say that's accurate if you look at the guys who are no longer playing.
Yeah.
Okay, the Ingrams, Cam Newtons, Leinart, Reggie Bush, and the whole list of other guys that are doing very successful right now in sports media.
Right, and they get invited to the Heisman House, of course, right?
The commercial?
Yeah.
I believe so.
Your Honor, I tender the lead.
Cross-examination, Mr. Teskey.
Coach Jeff, it's an honor to meet you. Thank you for being here today. I'll try to be brief. You talked about your history as a coach and dealing with players who had sleep apnea or sleep disorders. Did you play any of those players during the season when they had those disorders?
In many cases, not during the time until we got it fixed.
In some cases, though, the answer was yes.
In the times that I can think of, no, I don't believe we were really at that time.
When you discussed giving people a CPAP machine and things like that?
That's correct.
Was that during the off season?
Some were during the off-season, some were in the in-season.
Who were the ones you're thinking of in season?
With medical records, I'd rather go ahead and not say those names right now.
Do you know how many there are?
It's more than a handful.
How much is a handful?
4, 5, 6, somewhere in that range.
You ever have anybody with tonsillitis?
I'm not a doctor, so I would say I can't recall specifically tonsillitis. There's a number of other ailments, and there may have been players with tonsillitis that I asked the trainer specifically what it was.
When players get colds or flus or things like that, they've had occasion to play through those, haven't they?
Depends on the severity, depends on the player, depends on the situation.
Right, that's not a trick question, it's just all of these are individual circumstances, correct?
That's correct, all individual.
If Trinidad entered the NFL draft this year, would he get drafted?
I'm not in a position to say that because I have not done the work myself on that.
Well, given your experience in the NFL and at college now, do you think he would?
Again, to guess that, you can't make that guess without talking to all the people involved in that. It's the reason those assumptions are so unsound to make is because the people who make those assumptions don't have information. So to turn around and say like, of course so-and-so would get drafted, you're not in these rooms. You have no idea what's being said. You have no idea the number of times that we were in the draft room where you could turn on the New York sports media and they were guaranteeing that we were going to draft one of two players, neither of which were on our board. Okay? People were quoting me of saying things. I'm the one who took them off the board. Okay? So what you think to be perceived as absolute fact based on things, there's been Heisman Trophy winners who have gone undrafted. Hey, Jason White, I believe, went undrafted. Okay? So to turn around and assume is a very dangerous thing to do. And I'm not going to do that because I have not done the work and the mock-up of talking to the GMs, the head coaches, and finding out where their draft grades, needs, and all that would fall in line.
In your opinion, then, does Trinidad currently possess the skill set to be an NFL quarterback?
In my belief, he has a skill set. Yes, he does.
If Mr. Chambliss returns next year, is he going to win the Heisman?
Do I believe he has do I believe it's safe to say that he has an opportunity to compete for that and he has a chance of that based on what he did last year? Yeah, I do believe that.
And that's the point I'm getting at, though. You wouldn't go on record under oath saying he's going to win the Heisman, would you?
Well, the difference is I'm in college football, so I can comment right now on something I'm embedded in with college football based on the stats where he finished last year. I'm no longer in the National Football League. I don't have the inside information that's being delivered from scouts to the decision makers and the internal conversations that are going on. That's apples and oranges.
So any testimony you've given about the current state of the NFL, you don't really have any personal knowledge of because you're in the college world now.
Object to the question, Your Honor. That is completely disregards the witness's personal experience testimony he's given in direct.
That would not be accurate. I'm talking specifically about the draft and the evaluations of players for going forward. What I've talked about earlier is the need for development and where it lies in the league. That is accurate. That is expert testimony.
In your experience, then, does where a quarterback potentially gets drafted in the NFL draft, is that a mechanism of the other potential quarterbacks that are in that draft class, so to speak?
It's not purely just on the other quarterbacks. You're talking about where someone gets drafted, right?
Right.
Let me give you an example, okay? Some teams have round-based grading. Is he a first rounder, a second rounder, a third rounder, right? The reason I find that so inaccurate is you're talking about a player and where you think he's valued to go by round. If you talk by role, specifically if you say, what do I think about Jaden Daniels? Okay, Jaden Daniels coming out, I can say, based on my evaluation, I believe Jaden Daniels is an impact starting quarterback in this league. And he needs X, Y, and Z of development, and here's the issue we have to work with, and here's the team. But I can say in a one-liner, this is his role. The reason that's important is this. To guess based purely on round is assuming that everything else in the draft is completely in a vacuum relative to that player. There could be 32 offensive tackles that are just world beaters that everybody is going to not pass on and take those offensive tackles. And the best quarterback in the draft might be the first pick of the second round. There might be a situation where you've got a really good running back in the first round, but there's so many other good running backs you say, hey, listen, we know this guy's a first round.
Okay, you're going to slow down.
You may say this guy's a first round caliber running back. However, there's another half a dozen that are going to be available, we believe, somewhere between the third and the fourth round. We're not going to invest this high asset to take him there. That can lead to someone sliding back into draft status. So no, draft status is not purely involved based on someone's comparison of other players in the position. It's the entire draft, as it's put together in that puzzle.
So Trinidad's draft status in the 2026 draft versus the 2027 draft, potentially, we just don't know what the differences would be, do we?
No, not a crystal ball.
Yeah, there's no way to say one way or the other where he would go this year versus next year, correct?
Again, I have not done the mock-ups on those right there, so I have not talked to the NFL team to see where their draft grades and all that stuff is, and ties it into even a bunch of other things.
So I'll ask you a different way then. So as far as you're aware, there's no way with your specific knowledge to be able to tell where Mr. Chambliss will be drafted in this year's draft versus next year's draft?
Yeah, I'll make this clear. There's not a person in the world who could predict where someone's going to be drafted accurately, okay, without knowing the entirety of what the decision makers inside are doing. And because I'm not one of the decision makers at this point, I could not tell you the accuracy on that.
The quarterback school that you talked about at Ole Miss, that kind of education, that's something that Mr. Chambliss would receive on an NFL team, correct?
Not necessarily.
You don't believe that NFL teams would teach a quarterback how to go through reads and make quick decisions?
There's
things like
32
that?
teams in the NFL, all are independently run, all run differently based on the head coach and the administration there. I can tell you the teams that I've been a part of in the NFL, absolutely, he would get it A to Z. But we've also brought players into our facility from other teams that did not receive that kind of education on an individual basis holistically.
Were you the quarterback coach for Ole Miss last season?
I was.
Did you make the depth chart decisions on that team?
You know, it's a good thing is that you have an assistant coach who gets to coach all the quarterbacks, right? And the quarterback's coach. And you have a head coach who gets to make the decision who goes out there and plays. My job is to coach every player, maximize their potential, put them in a position to play, that everyone is in a playable position to help us win. And then the head coach gets to make the decision on who he wants on the field.
Did you make the decision that Trinidad would start the season as the backup last year?
I did not.
Were you a part of that decision?
As far as giving an opinion,
Yes.
yeah, I have an opinion.
Was it Austin Simmons who was the starting quarterback at the beginning of the
Austin did. Austin started the first 2 games.
season? What happened to Mr. Simmons?
He got hurt.
And that's when Mr. Chambliss stepped in, correct?
That is correct.
And he was outstanding, no dispute about it, no debate about it. He was wonderful, correct?
That's correct.
Is there anything that guarantees that what happened to Mr. Simmons won't happen to Mr. Chambliss at any point in his career?
Is there a guarantee that
He doesn't get hurt next year,
there's not a guarantee on that for anybody?
right? And in the NFL, is there a guarantee that he won't get hurt in the NFL?
I don't understand the question.
Is there a guarantee he will remain healthy
There's
during?
never a guarantee on that for anybody.
Right. So if we're talking about success in terms of where Mr. Chambliss will go in his career, if he gets certain education, where Mr. Chambliss will go based on what team he's drafted to, there are certainly things that are just outside the control of the football game itself and the football coaches that are working with Mr. Chambliss that could very well impact his career trajectory.
Yeah, the controllable things that we control is the development of the players from a position to play. All right, this building gets struck right now by lightning. We don't have control over that. We wouldn't really make a decision based on what we're going to do going forward.
Well, now, Coach.
So,
I don't think I have anything else. Thank you, Rock.
Very short.
Huh?
Very short, Your Honor.
Very short.
All right. Coach Judge, one thing we do know about the 2026 draft versus the 2027 draft is that Trinidad would have one more year of college development, right?
that's accurate, yes.
And just as generally speaking, quarterbacks that are more developed because they played a couple seasons of college football, they are likely to go higher in the draft, aren't they?
That is correct, that's accurate.
Do you believe it's in Trinidad's best interest that he get that additional year of collegiate development?
I absolutely do.
Thank you. No further questions.
All right, you guys step down.
Right.
What time do we have?
It's 11:30. Your Honor, do you mind a 5-minute personal break?
All right, we'll take about a 10-minute break. I know we got a lot of people, got bathrooms, so take a break and come back in at your leave here, but artists and lawyers and so forth, come back in about 10 minutes. We'll take a break. Yeah, we're gonna take a break.
I've got to slide by.
No, you go right ahead.
Jump the rail.
Yes, sir. I'm honestly gonna drop down my thing, so when you get out of here, don't wait till everybody.
I'll be fine.
Hey, I walked just in there to the table. My stomach is growing. I should have into the trash. Yeah, I will. Chambliss.
Is that Trinidad's father?
Yes, it is.
How long have you been married?
25 years.
So longer than Trinidad's been on earth.
Yes.
How old is Trinidad?
23.
Thank you. Where do you live?
Grand Rapids, Michigan.
Okay. Are you employed at the moment?
I am currently retired.
That nice?
It's very nice.
I want to jump around a little bit in Trinidad's history and ask you what you witnessed and you observed, okay?
Yes, sir.
In the year 2020, when he got mononucleosis, was diagnosed with that, were you in a position to observe his symptoms?
Yes, I was.
Can you tell us what he experienced in the way of symptoms?
Yes. High fever, sore throat, extreme exhaustion, just overall fatigue, lethargy, lack of appetite.
And when he was diagnosed with COVID in 2020, was that during his senior year in high school?
Yes, it was.
Do you remember what his COVID symptoms were?
Yes, those were similar. He had sore throat, he had high fever, very tired. He did lose his sense of taste and smell, and of course, the lack of appetite.
After those two illnesses that happened in the same year, right?
Yes.
After those two illnesses, did you see a change in Trinidad's ability to exert himself physically like he would have to do training, working out, conditioning?
I did. I saw a slowdown. He just was tired all the time. And the usual very active young person that he was, because he was always very active, there was a change. And he just didn't have the energy. He would come home from school, was very tired, slept a lot.
Did he complain to you about lacking energy?
He did. So sometimes we tried to problem solve that, right? Like, okay, what can we do to boost your energy? Can we drink more protein shakes? Can we take more vitamins? Can we take more medication? We just were a bit at a loss.
For lack of better words, after the COVID and after the mononucleosis, were you the walking pharmacy?
I was, and I would joke with my husband and family about that. Like, anybody would come to me, right? Because I'd have everything. Yes, I probably should have had stock in one of the pharmaceutical companies, or the manufacturers of NyQuil, DayQuil, because I have that constantly. Claritin, all of those things.
You know what it means to take a medicine prophylactically? I probably mispronounced that. To take a medicine just to ward off illness.
Oh, proactively? Yeah. That's what we were doing. I was just very, I guess, paranoid about Trinidad getting sick because I did not, number one, want him to miss any school. He was a good student, but he had to work for his grades like me. As I told him, I said, you can't afford to be sick. And that means you can't afford to miss school. You can't afford to fall behind either in school or your athletic training, because so much of our time, energy, and has gone into this.
Was he on scholarship at Ferris State?
Yes, he was.
Was a condition of that scholarship that he stay in school, make sufficient grades, and also participate in football at whatever level he was capable of doing?
Yes.
Could you and Mr. Chambliss have afforded for him to lose that scholarship?
No.
How did you react? Like, in periods of time when you saw he's just not working out hard enough, and he's not gaining weight, and he's not progressing in his development, what was your initial reaction to that?
I would get on him. I would get in his behind and tell him, let's get going. We can overcome this, mind over the physical. And so at times, and there are times I look back and I regret maybe being a little too harsh on him. But it ended up that I was proven wrong. It was not just in his mind, it was a physical problem that he had.
And when did you find out that you were proven wrong?
When Dr. Howard told us that his tonsils and adenoids were infected.
And what else did Dr. Howard do? Are you talking about the first time Trinidad went to see Dr. Howard in August of 2022?
Yes.
Okay. What else did he tell you in the way of problems that his tonsils and adenoids were going to cause Trinidad to have?
Obstruction of breathing. I mean, he just wasn't bringing in enough air as an athlete, to be able to perform at the level that he was capable of previously. And that could, cause him to have a lack of good sleep, which can, poor nutrition because his just appetite is lower, just a whole bunch of things that could be a negative impact.
Did you witness him having problems with his sleep?
Absolutely.
Explain to us what you witnessed.
He snored very loudly. I could hear him through his bedroom door. If he ever fell asleep on the couch or in the living room, TV room, I could hear him snoring extremely loud. We joked about it, laughed about it, but it really wasn't funny because there were times that he would stop, literally, in my opinion, he would stop breathing.
Why do you say in your opinion?
Well, I'm not a doctor, but he literally, I couldn't hear him breathing anymore. So I would put my hand over his mouth or his nose to see if there was any breath. Also just watching his chest, whether it was going up or down. But I was very concerned about that.
Did you ever talk to did you go to the visits with Dr. Howard?
Yes, I did.
Did you ever talk to Dr. Howard about, look, kid doesn't breathe for some period of time during sleep?
Yes, I did.
What did he tell you?
Well, he said he definitely had sleep apnea and that was not a good thing. And that the inflamed and infected tonsils and adenoids were directly affecting that.
Was Trinidad sick when he returned to school at Fair State in the fall of 2022?
I'm sorry?
Was Trinidad sick when he returned to Fair State in the fall of 2020?
Yes, he was.
How do you know that?
Because I bought all kinds of medication for him. He and I are close, regular communication. If he ever wasn't feeling well, called me. I ordered medications from over-the-counter medications from Big Rapids Walmart or Myers and had them delivered or told him go through Walgreens. This is what you're going to get. We need to stay on top of this. You cannot miss school.
Okay. You were 1 hour away from him, right?
Yes,
Would you check with him frequently during the week?
absolutely.
How many times a week? In the fall of
What?
2022?
Yeah, well, let's say how many times a day
Okay.
probably is more accurate.
What
Quite
was
often.
What was your concern? I mean, other than the fact that your son was telling you he felt bad, what was your concern? Why were you so vigilant in checking with him?
Because I didn't want him to miss any school. I needed him to be healthy. I needed him to be in better shape so he wouldn't jeopardize the scholarship from Ferris and that he would be able to maybe play one day.
What was your understanding of his status on the football team during the fall of 2022?
That he was medically redshirted.
And how did you find that out?
Well, first Trinidad told me,
Okay.
and that's what we all knew for that whole entire year. I did have a conversation this past fall with Coach Anise specifically when we were, in communication with Ferris about this whole thing. And Coach Anise reiterated to me that it was considered a medical red shirt, and he made mention of, wishing they had actually filed the paperwork on that, but it was a medical red shirt. He reinforced.
So it's your understanding that Fair State declared him a medical red shirt in 2022, but did not file any paperwork?
Correct.
Now, what do you understand is the reason for it not filing the
I understand because they made the assumption that he was remaining at Ferris and that they didn't foresee this, that he would be transferring to an SEC or D1 or any other school. So they saw no reason to actually file it, is what I was told.
From your understanding, if Trinidad was still at Fair State right now, would he be able to play in the fall of 2026?
He would.
Why is that?
D1 rules are different than D2, and he hasn't exhausted what that entails for D2 qualification.
Do you remember when Trinidad came for the first time to visit Ole Miss?
I do.
Okay, when was that, roughly?
That was April of last year.
Okay. Were you with him?
I was,
Did you meet with any of the personnel at Ole Miss football?
yes.
Did you meet with a person who was at that time the general manager of football named Billy Glasscock?
Yes, I did.
What did Mr. Glasscock tell you and Trinidad about how many more years he would have left to play after transfer?
Then he would have 2 more years to play football.
And is that because in 2022, he was a medical redshirt?
Correct.
I think even newspapers, before he actually transferred to Ole Miss, published that he had 2 years left to play. Are you aware of that?
I am.
And Trinidad, after the 2024 season, gave an interview to like a Fair State journalist or somebody connected with the athletic department.
Yes,
Have you watched his interview?
I have.
In that interview, how many more years does Trinidad say he's got left to play before he even arrived at Ole Miss?
2 years.
Let's talk about a surgery that he had in December 2024. Did you stay with him pretty consistently during his recovery from the surgery?
Yes, I don't want to embarrass him, but I actually slept in the same family room that he was recovering in, just because of what was happening during his recovery.
Did he complain during his recovery about
Oh,
feeling bad?
absolutely, yeah. Yes, he did, yes.
What did he say?
That he was he thought he was dying, for one, but he was in extreme pain. And it was honestly the most pain I've ever seen him in. And he's had injuries, kids do. And it really it reinforced what Dr. Howard had originally said, how painful this type of surgery is for adults. Didn't really believe it at first, but then I witnessed it with my own child, and it was bad.
Had you encouraged him to have the surgery at that point in time?
Well,
I'm just curious.
I wanted him to feel better,
Yeah.
but initially I didn't want it to interrupt school. And I know we talked about that earlier, but I know him and I knew it was going to interrupt school. So initially, I knew eventually he should have it. So to answer your question, yes, eventually.
To your knowledge, was there something about the timing of that surgery? And by that I mean, was there something that Trinidad was trying to achieve before he had that surgery?
I'm sorry, what the question?
Yeah. Trinidad didn't play football in 2021, right?
Correct.
He didn't play a single snap of football in a game in 2022, correct? He played a little bit in 2023, correct? All right. And in 2024, he becomes the starting quarterback at Fair State and has a really good year.
Yes.
Okay. Do you know whether or not your family was putting off that surgery until he could achieve something meaningful on the football field?
Yes.
After he recovered from the acute pain of the tonsillectomy procedure in 2024. Did you notice some changes in Trinidad?
Extreme changes. He could breathe. He wasn't snoring anymore. He was getting a good night of sleep. His school was going great. Not that it was going poorly before, but just that wasn't a concern at all. No, he just had all this energy. I mean, he's a totally different athlete after having it.
Thank you. Your Honor, I tender Mrs. Chambliss for questions.
Cross-examination, Ms. Askew. I've been asked to set up with some of these back in here. Cross-examination, Ms. Askew.
Thank you. Ms. Chambliss, I just want to say congratulations on raising an outstanding young man. I don't have any questions.
Thank you.
It's been your practice to meet with Trinidad on the sideline before he starts the game.
Yes, sir.
That's some good words of wisdom for him and somebody else.
Yes, the Lord Jesus Christ.
You did.
Absolutely, Your Honor.
All right, thank you.
You're welcome, Your Honor.
Yeah.
Call Mr. Trinidad Chambliss, Your Honor.
All right, gentlemen, it's 12 o'clock. You all want to start, my plan would be if we take Trinidad to take him on the break and break for lunch before cross, unless we move pretty fast. Do y'all have preferences on how we go from here? Or would you like to break for lunch now? Bring it back up.
My preference would be right now because I probably could be more efficient if I take a look at my notes and limit it to, new information and not things that a couple of witnesses have repeated.
I certainly will, during that time, will be reviewing all the pleadings, the evidence, and everything that's been presented to start ready to hopefully make a decision sometime.
We don't have a preference, but since Mr. Liston said he'll be more efficient, we kind of want to do that.
I did not guarantee it. I'm just saying.
I understand you. Doug, if you be more efficient, you'd like to go ahead and break?
Yes, sir.
I said he's very well. All right, well, I tell you what, we're gonna take a break for lunch. How long, there's not many places to eat around this place. So, I'd say be back at 1:30?
Yes, sir.
1:15, what do y'all think? An hour 15, hour
30.
I would say 1:15.
1:15, all right, gentlemen. 1:15, all right. Yes, sir.
We're going to drive to McDonald's. That's 30 minutes down.
That's a great question. No. I just kind of want to walk around. My ass hurts. I'm great.
Camera is on fire.